Hi guys, pleasant day to everyone, and our topic for this particular video under online nursing review alternative will be the five-finger modification. The five-finger modification is a basic test-taking technique. It's an original concept of mine, and you can use it together with the Itsumo test, or if you just want to use it on its own, it's good. A lot of people doesn't like to use test-taking strategies, but the five-finger modification is a good technique even if you don't like to use test-taking skills. Okay, so five-finger modification. This is the reason why you could see me in the pictures, and I am always pointing out my middle finger. Some people think that I am just raising my bad finger or anything like that, or it's just an angst or the thing that I do. I get frequently criticized because of this thing, but in reality I'm not really raising my bad finger, and I am not encouraging my students to raise their bad fingers, but what I encouraging them to do is to do the five-finger modification. If you learn this is a good addition for you guys whenever you're taking any type of multiple choice examination. So without further ado, let's start the concept of five-finger modification. Okay, so before we go with the five-finger modification, okay, let's talk about the board examination question. Okay, so anatomy of the board examination question. Let's start. Okay, so a board examination is commonly long. That's why it's easy for our students to get overwhelmed with information. Now, there is a way for you not to be overwhelmed with information, and that is by breaking down the board examination question into its parts. So I have here an example of a board examination question. Okay, so the doctor orders, reads guaifenesin 250 mg per rm every 8 hours for 3 days. The bottle is labeled 150 mg per 5 ml. How many ml should be given per dose? So we have 4 choices here. We have 12 ml, 13 ml, 13.5 and then 12.5 ml. Okay, so now let me just get my pen. Okay, now this is a good example of a board examination question. I know that you guys have already encountered a lot of board examination questions, and the thing about it is, have you really tried to understand kung sino yung board examination question? Do you really know who is the board examination question? Third year pa lang tayo sa College of Nursing, third year, fourth year. Usually yung mga examinations natin galing na sa mga past board examination questions, or minsan kinukuha ng mga clinical instructors or professors natin sa mga NCLEX books, CGFNS books. Okay, so third year, fourth year pa lang tayo, third year, fourth year, marami na tayong na-encountered na board examination questions. So, and then pag nag-review tayo, we encounter also a lot. But the thing about it is, kilala ba natin kung sino siya? Sa lahat ng mga war strategy books na makikita nyo, it's always sinasabi is to know your enemy. So, you have to know your enemy. So, I will teach you right now kung sino ang board examination question talaga. So, okay. So, now, the board examination question has 3 distinctive parts. The first part, okay, is from here to here. Okay, so this is the first part. As you can see, this is the part that is not yet asking anything, but rather it's telling you a story. Okay, so it's not asking, but rather it's telling. Hindi siya nagtatanong, bagkus siya ay nagkikwento. Okay, this is what you call the situation. Okay, what do you call this particular part? It's known as the situation. Okay? Now, the next part is this one. The one that comes after the number and the one that is already asking the question. Okay? This particular part, as you can see, this is the one that is already asking the question. This is known as the stem. What do you call the part that tells a story? Situation. What do you call the part that asks the question? Stem. Parang halaman. Okay? Stem. Now, of course, comes this part. The part where you choose from. These are known as the choices. Again, what do you call the part that tells a story? Situation. What do you call the part that asks the question? Stem. And what do you call the part where you choose from? Choices. Very good. Okay? So the choices is basically composed of two parts. So, ibig sabihin, the choice is still subdivided into two parts. There is a choice. In this case, it's letter D. This is the choice that answers the stem. So, what do you call the choice that answers the stem? It's known as the correct answer. And then all the other choices aside from the correct answer, they are simply known as distractors. Why are they known as distractors? Because they have one purpose in life. And what is that? It's to take away your attention away from the correct answer. What do you call the choice that answers the stem? It's known as the correct answer. Very good. And then, of course, what do you call all the other choices? They are known as distractors. Now, how many choices do we have? We have 4 choices. And out of the 4 choices, how many correct answer do we have? Very good. We have 1 correct answer. And how many distractors do we have? We have, very good, 3 distractors. In the local board exam and in most multiple choice examinations, there's only 1 correct answer. So pag feeling mo dalawa, guess what? Hindi pwede. Kasi isa lang ang tamang sagot. Pag feeling mo lahat tamang sagot, guess what? Again, hindi pwede kasi isa lang ang tamang sagot. Okay? Now, there is a way for you to answer. Sometimes, you can just go for the correct answer. For example, you're asked a question and you know the answer. Just go immediately for the correct answer. Or, there is another way of doing things. Okay. Now, ilan ang tamang sagot? Isa. Since isa lang ang tamang sagot, there is a fraction that you could use. And what is that fraction? It's 1 over 4. Why 1 over 4? Because you only have 1 correct answer for every 4 choices. If you will convert this fraction to percentage, you can see that you have 25%. Okay. So, ganun pala yun. Lahat pala kayo, kahit feeling mo ikaw yung pinakamatalinong student, meron ka lang ilan? 25% in getting the correct answer. Kung feeling mo naman ikaw yung pinakamahinang student, huwag mo mawawala na pag-asa. Bakit? Meron ka pa rin ilan? You still have 25% in getting the correct answer. Malaki, maliit? Very good. Maliit. Okay? Now, for example, this is the question. This is the full question. This is the situation. This is the stem. These are the choices. And hindi mo alam ang tamang sagot. Okay? Alam ko ba tamang sagot? No, hindi ko alam. Okay? Pero may alam ako. And what is that? Alam ko that it's not letter A. Okay? So, I don't know the correct answer, but I know that it's not letter A. Therefore, what is letter A? Letter A is a distractor. Therefore, what could I do? Okay? So, I could eliminate. In my book, I call this burning. Why? I took it from the expression known as burning the hay. Okay? It's like, have you ever heard of the expression, it's like finding a needle in a haystack? Why is it hard to find a needle in a haystack? Because you're looking for a very small thing in a big amount of place filled with other things. In this case, our haystack is our choices. The needle is the correct answer and the hay are the distractors. Okay? How do you find a needle in a haystack? What you could do is you burn the hay. Because at the end of the day, needles don't burn. So what you do is you eliminate each of the distractors until you come out with the correct answer. Sa ibang students, kapag nakatanggal sila ng isang maling sagot, sabi nila, ano ngayon? Nakatanggal lang naman ako ng isang maling sagot. Okay? It doesn't change anything. Actually, it changes everything. From 1/4, the fraction is now 1/3. From 25%, your chances of getting the correct answer has dramatically increased to 33.33%. By just taking away a distractor, we have already done this. Taking away a distractor is known as the process of elimination. In my book, Nursing Board 101, I call it burning the hay. And elimination, guys, is the foundation of test taking. It's the more you eliminate, the higher the chances of getting the correct answer. It's always eliminate, eliminate, eliminate. Burn, burn, burn. Okay? Balik tayo dito sa tanong. Hindi ko pa rin alam ang tamang sagot. Alam ko na hindi yun yung letter A. Letter A has already been eliminated. Now, I know another thing right now. And what is that? Not the correct answer, but, okay, I know it's not letter C. Therefore, what is letter C? Letter C is another distractor. And what could I do now? Burn. Shh. Yeah, I make sound effects whenever I'm doing this. Shh. You can make your own sound effects. Okay? Now, what happens now? The fraction, again, change. From 1/3, you are now up to 1/2. Okay? And then, of course, the percentage also change. From 33%, you are now up to 50%. Maybe you don't see the change from 25% to 33.33%. But now you can see, okay, the drastic change from 25% all the way up to 50%. And this is as good as it gets. Why? Because whenever you have a question and you are choosing between 4 choices, that is what you call a multiple choice type of question. But whenever you have a question and you are only choosing between 2 choices, okay, what type of examination is this one? This is called a true or false examination. Isa na lang dyan mali, isa na lang dyan tama. Kahit sa Who Wants to Be a Millionaire, anong pinakamagandang helpline, guys? Yeah, I know. Pinakamagandang helpline is none other than 50-50. Okay? As the audience, alam naman natin, hindi reliable yun. Call a friend. Kung nanonood kayo ng Who Wants to Be a Millionaire, anong ginagawa ng mga friend na tinatawagan? Sasabihin ng friend, ubos na yung time. O kaya naman, can you repeat the question? Kung hindi ganon, sagot ko letter B, pero hindi ako sure Ba't pa kita tinawagan kung hindi ka pala sure? Okay? So, gusto nyo ba magkaroon ng 50-50 sa board exam? So, you can use this particular method. Okay? Again, let's have a recap of what we have talked about. What do you call the part that tells a story? Situation. What do you call the part that asks the question? Stem. And what do you call the part where you choose from? Choices. Okay, the choices is still subdivided into two parts. The choice that answers the stem is known as the correct answer, and all the other choices aside from the correct answer are known as distractors. Okay, and how do you find a needle in a haystack? You burn. Okay, so now let's go to the five-finger modification. Okay, now whenever students see a question, what they immediately want to do is to answer that particular question. That's a wrong move. Okay, maybe earlier pinapakita ko pa lang sa inyo yung example of a board examination question. Some of you are trying to answer this particular question already. Hindi ko pa naman pinapasagutan, pero bakit sinasagutan nyo na? Okay, it's because of that particular discipline, that whenever you see a question mark, what you want to do is to immediately answer. Okay, now I'm telling you right now, don't answer the question immediately. Huh? Mr. Rontalan, don't answer the question immediately. What should we do? Okay, yes, I want you first to modify. Can you say that? Modify. Okay, before answering anything, I want you to modify the question. Okay, this is establishing your critical thinking para hindi yung immediately parang reflex action ang ginagamit mo. I want you to think first before you answer. So I want you to modify the question. Okay, so how do you modify the question? You will use the five-finger modification. Okay, you will use the five-finger modification by the 5 non-dominant modification tools. And kaya ako sila tinawag na 5 non-dominant modification tools is basically kasi sila ay nasa iyong non-dominant hand, and 5 sila, kaya 5 non-dominant modification tools. Okay, okay, so you can see me right now. So the five-finger modification using the 5 non-dominant modification tools. So I want you to raise your non-dominant hand. Kung hanggang ngayon hindi mo alam ang dominant sa non-dominant hand mo, ha? Sige. Now, I want you to raise your non-dominant hand. Ay, taas mo yan. Hindi magtaas pangit. Nakikita kita. Okay, so I want you to close it. Close it like this. I want you to count with me. Ready? 1. Not like this, ha? Like this. 1. 2. Not like so. Like this. 2. 3. 4. 5. Let's close it. Let's count together. 1, 2, 3, 4, 5. You think you can do this on your own? Okay? Do it. Close. Count. Very good. Okay, so each of the finger is a representation of a tool that you could use to modify the question. Okay, so first finger. Okay, now I'll use this hand even though this is not my non-dominant hand. Okay, I'll use this because I'm wearing a bigger ring here, so that you can appreciate if I'm raising my ring finger or if I'm raising my middle finger. That's the basic reason kung ba't pag nakikita nyo ako sa lecture, lalong-lalo na kapag maraming students, is I'm wearing a big ring. Usually I'm wearing my black ring, I'm wearing my onyx ring. It's basically for the students to see if I'm raising my middle finger or if I'm raising my ring finger. Okay, so let's start. Okay, first finger. Okay, now what do you remember whenever you see this finger? Remember, each of the finger is a representation of a tool. So the first tool is this one. Okay, so what do you remember whenever you see this particular finger? Okay, now I will remind you something. Remember when you're back in high school and you're doing the sign language thing, something like that? Okay, yes. So there's a letter represented by this finger. And what is that letter? This is the letter I. Okay, remember, it's not J. When you say J, you have to do this. But if it's just like this, it's letter I. Diba sabi mo sa crush mo, I love you. Nobody but you. Okay, anyway. So, I. Bakit I? Okay? Kasi, this finger represents what? It represents the issue. Okay, so what's the issue? Kaya I, kasi issue. So, the issue is the question, or it's the problem that the question is asking for. For example, bago kita bigyan ng mahirap na example, bigyan muna kita ng isang madaling example. For example, tanong ni Mr. Untalan sa'yo, anong kulay ng notebook mo? Okay, what is the issue in that particular stem? Okay, is it the notebook or the kulay? Okay, if you answered ka agad, diba? Sumagot ka, blue. Oh, you forgot one thing. Like I've said before, don't answer immediately. First, modify the question. Unang-una mong itatanong sa sarili mo is, anong issue dun sa tanong ni Mr. Untalan? Okay, the issue in that particular question is none other than kulay. Okay, so it's not notebook, but rather it's kulay. So that's the issue, the problem that the question is asking about. Okay, it could be a drug. For example, sabi nung stem, among the following drugs, what is contraindicated for this type of patient? Now, what is the issue in that particular stem? It's not the contraindicated, but rather it's the drug. Okay? It could be a nursing problem. For example, the stem states, among the following nursing problems, what is our priority? Okay? It's not the priority that is the issue, but rather it's the nursing problem. It could be a behavior, a disorder, a procedure, a DOH program, or even a vaccine. Okay, now I want you to raise your issue and I want you to repeat after me. Okay, raise your issues and then repeat after me. Whatever is the issue, that is the only possible answer. Can you say that again? Whatever is the issue, that is the only possible answer. Ano ibig sabihin nun? Ang ibig sabihin nun, kung ano yung tanong, yun lang ang pwedeng sagot. Halimbawa, tinanong kita, anong kulay ng notebook mo? Sumagot ka, makapal. Is there any way na tama ang sagot mo? There's no way na magiging tama ang sagot mo. Why? Kasi ang issue, kulay. Ang pwede lang na sagot, kulay. Okay, let me go to a stem. For example, this stem. Look at the stem in this particular question. Sabi niya, among the following vaccines, what is best for our patient? What's the issue there? Okay, I want you to mark the issue. How do I mark my issue? I simply make a simple underline like this. Okay? Once nakilala mo na ang issue, you can now perform a procedure known as check, check, check. And what is check, check, check? Check, check, check is basically checking are all the choices coincides with the rule of the issue. Remember the rule of the issue? Whatever is the issue, that's the only possible answer. Okay? Therefore, is this a possible answer? BCG, we know that's a vaccine. Check. Is this a possible answer? this is not a possible answer because this is paracetamol. This is a drug. X. Is this a possible answer? DPT, we know that's a possible answer. Check. Is this a possible answer? Anti-measles vaccine, that is also a vaccine, therefore, check. Do you see something? What do you see, guys? Look at that. Letter B is not an issue. Remember, what's the rule of the issue? Whatever is the issue, that is the only possible answer. Therefore, what are we looking at? It's a distractor. Therefore, what could we do? Shh, burns. What happens now? From 1/4, your fraction goes to 1/3. From 25%, your percentage has already increased, okay, to 33.33% by just knowing the simple and the humble issue. Okay, so that's how you use the issue. So again, what is this finger for? Issue. Okay, and what's the rule of the issue? Whatever is the issue, that's the only possible answer. And then of course, next finger. Okay, so I'll use this finger again. I'll use this hand again for you to appreciate it well. Okay, what is the next finger? Here. Okay, now what does this finger reminds you of? Very good, the ring. Sa aming may mga asawa na, nandito ang aming wedding rings. And what does the wedding ring remind you of? Your wife or your husband. Okay, sa isang may asawa na, at least in an ideal situation, sinong pinaka-importanting tao sa kanya? Very good, walang iba kung hindi ang kanyang significant other, ang kanyang asawa. Okay, so anong pinapaalala nito sa atin? Remember, what type of examination will you take? Very good, a nursing examination. Therefore, you will play the role of being a nurse. Sa isang nurse, sino ang pinaka-importanting tao sa atin? Walang iba kung hindi ang ating patients. Kaya lang, patient is a term that could be used for the sick. I need a term that could be used for the sick at the same time the well. Okay, so identify the client in the situation. Okay, so again, what is this finger for? Issue. Okay, and what's the rule of the issue? Whatever is the issue, that's the only possible answer. And then of course, next finger. Okay, so I'll use this finger again. I'll use this hand again for you to appreciate it well. Okay, what is the next finger? Here. Okay, now what does this finger reminds you of? Very good, the ring. Sa aming may mga asawa na, nandito ang aming wedding rings. And what does the wedding ring remind you of? Your wife or your husband. Okay, sa isang may asawa na, at least in an ideal situation, sinong pinaka-importanting tao sa kanya? Very good, walang iba kung hindi ang kanyang significant other, ang kanyang asawa. Okay, so anong pinapaalala nito sa atin? Remember, what type of examination will you take? Very good, a nursing examination. Therefore, you will play the role of being a nurse. Sa isang nurse, sino ang pinaka-importanting tao sa atin? Walang iba kung hindi ang ating patients. Kaya lang, patient is a term that could be used for the sick. I need a term that could be used for the sick at the same time the well. Okay, so identify the client in the situation. Okay, so identify the client in the question. Who is the client? The client is usually the person with a health problem. It may be one of the following. 75% ng cases na may encounter nyo, guys, the client is none other than the patient. Ano ibig sabihin nun? Ibig sabihin, majority ng cases na may encounter nyo, the client is none other than the patient. On the other 25%, okay, it could be a relative or significant other, another member of the healthcare team, the student, in CHN it could be the community, or even a lay person. Kung ang issue may rule din ang client. And what's the rule of the client? The rule of the client is the only possible answer is a client-centered answer. Let me repeat that. What is the rule of the client? The only possible answer is a client-centered answer. Ano ibig sabihin ng client-centered answer, Mr. Untalan? Okay, a client-centered answer means the answer is focused on the client. Layman term, ang uunahin palagi ay walang iba kung hindi ang client. Sino unahin mo? Procedure o client? Client. Sino unahin mo? Doktor o client? Client. Sino unahin mo? Sarili mo o client? Still the client. Remember, if there is a fire in a hospital, let me give you a good example. If there's a fire in the hospital, what is that acronym, okay, that you should follow? The acronym is RACE. We will be discussing that in a different video, okay, but basically the acronym is RACE. And what is R in RACE? The R in RACE is rescue or remove the client. Bakit hindi run? Okay, bakit hindi evacuate? The evacuate is in the last letter. It's because of the simple fact that, always remember, the board examination is a client-centered questions. Okay, ibig sabihin, the board examination, ang unahin nyo palagi is none other than the client. Okay, so let me give you an example of a STEM. Okay, so this is the STEM. What nursing intervention would best benefit the patient? As you can see, okay, first things first, let's look for the issue. Where's the issue here? Okay, the issue here is nursing intervention. I will mark it with a simple underline like this. Okay, so I'll mark it with a simple underline, and then I will perform the first wave of check. Is this a nursing intervention? Yes, 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 check. Damn. Bakit? Wala tayong natanggal kay issue. Oh, di bali na, may bago namang tinuro si Mr. Otalan. And what is that? Okay, identify the client in this STEM. Okay, so let's identify the client in this particular STEM. Okay, the client here is none other than the patient. I will mark the patient with a simple and circle like this. Okay, now I will do the second wave of check. Asking now myself, is this client-centered? Is A client-centered? Yes. Is B client-centered? Okay, yes. Is C client-centered? Okay, yes. How about letter D? Now, monitor for complications. Up to here, client-centered pa siya. Pero, ano na una? Notify the physician. Ano napansin nyo? It's not client-centered. Therefore, X. What are we looking at? What is letter D? Letter D is a distractor, and what could we do? We could burn it. So from 1 over 4, you are now up to 1 over 3. From 25%, you are now up to 33.33% by just knowing the client. Okay? Imagine niyo, if you have removed 1 for the issue and another 1 for the client, you already have 50%. But you cannot win them all. So, masaya na dapat kayo kapag naka-eliminate kayo kahit isa lang. Okay? Let's have a recap. Ano to? Issue. What's the rule of the issue? Whatever is the issue, that is the only possible answer. Ano daw to? Client. What's the rule of the client? Okay, always remember that the only possible answer is a client-centered answer. Okay, now let's go to my favorite finger. That's the reason kung bakit nakakaganito ako sa mga pictures ko before sa FB, sa Friendster. Okay, yes, it's because I am emphasizing this particular finger. Why? Because this is the most important in the five-finger modification. Bakit siya pinaka-importante? Because of the fact na these two fingers, okay, these two fingers are dependent on this one. Ibig sabihin, the last two fingers are dependent on this one. And what is in this particular finger? It's none other than the keyword. Okay? Yeah. Keywords. Keywords focuses your attention on what is important. Sometimes they do appear in a different size or fonts, but most of the times they don't. Okay? Now, dati yung mga keywords minsan naka all caps, or sometimes naman italicized, or minsan naka-bold. But right now, very rare ko na silang nakikitang nakaganon. Okay? So you have to learn how to look for them. Okay? So, what are the examples of keywords? Example itself is a keyword. Priority is a keyword. Early symptoms is a keyword. Okay? Initial, late symptoms, vital, best, worst, and my personal favorite keyword. It's none other than except. Now, I know most of you guys doesn't like to deal with the word except, because except changes a lot of things. Actually, except is a challenging keyword. I will not say na mas madali ang question pag may word na except, pero you can deal with the word except. Okay? Madali lang siya pag alam mo how to deal with it. Okay, so let's go back to the stems that we have already discussed. And first things first, in this particular stem, I want you to identify where's the issue. Very good. Nasabi na natin kanina, the issue is the vaccine. I want you to identify where's the client. So the client here is the patient. Circle it, and I want you now to identify where's the keyword. The keyword here is best. If you guessed that the best is the keyword, very good. That's the keyword. And right now, what I want you to do is to box it. Remember, underline the issue and circle the client, box the keyword. Underline the issue and circle the client, box the keyword. This is how the people that knows the modification techniques do this. Okay? Let's go to this one. Where's the issue? Very good. Nursing intervention. And what should I do? Underline. Where's the client? Patient. What should I do? And circle. Where's the keyword? Okay. And what should I do? Very good. Box. Underline the issue and circle the client, box the keyword. Underline the issue and circle the client, box the keyword. Okay? Now, of course, the most common question that I have encountered here is, Mr. Mutalan, do we really need to do that? Do we really need to do that? Okay? Well, ito yung ginagawa ng mga nagpo-follow ng modification techniques and ng Itsumo test. Actually, you don't need to do this. If you want, you can just underline everything. If you want, just underline everything. If you want, you can just encircle everything. Okay, gusto mo maarte ka, pauso ka na sa'yo, you can star the issue, heart the client, and then flower the keyword. Okay, yes. Baka maubos yung time mo sa paglalagay ng details, ha? Actually, guys, you don't need to do this. Kaya lang, ang ine-emphasize ko lang is sulatan nyo yung questionnaire. So, sulatan nyo yung questionnaire. Sabi ng isang research is, the more daw sinusulatan ng isang examinee yung questionnaire, it's the more chances na nag-iisip siya. So, sulatan mo yung questionnaire. Sa actual board exam, you can write at the questionnaires. If you're taking HAAD, if you're taking NCLEX, you can scribbles. You can do scribbles. Kasi test base nyo is sa computer, no? So, you can do some scribbles in a pad. You will be given a chance to be given a paper there. Okay, so pwede kayo mag-scribbles. Okay, so again, let's have a recap of that. Ano daw to? Issue. Okay, and what's the rule of the issue? Whatever is the issue, that is the only possible answer. Okay, ano daw to? Client. Okay, all possible answers are client-centered. Ano daw to? Keywords. Okay? Yes. Now, keyword ang magsasabi kung time na para Okay, tandaan nyo, ang keyword ang magsasabi kung time na para Okay. Ano naalala mo pag nakikita mo tong finger na to? Maybe point? Think? Okay. Anong number siya pag mag-isa lang siya? It's number? Okay, it's number 1. Okay, and gawin mo nursing. Keyword ang magsasabi kung time na para prioritize. So, prioritization is asking yourself what comes first and what is the most important or what gets the highest priority. Okay, so that's prioritization. Kaya nandun siya sa, yun ang magpapaalala sa yung finger, yung number 1. Okay, now paano mo malalaman kung time na para mag-prioritize ka? Okay, yes, ang magsasabi sa iyo ay walang iba kung hindi ang keyword. So let's look at this particular stems. Okay, so first stem, where's the keyword here? If you want to go with initial, that's a good keyword. Very good. If you want to go with initial response, okay lang yon. Wala namang rule na nagsabing isang word lang ang keyword. So, pwede kahit more than one word. How about the next stem? If you want to go immediate, if you want to go with immediate consideration, how about the third stem? If you want to go with priority or highest priority. How about the last? Okay, if you want to go with first or if you want to go with done first. Always remember, kahit kalahati na ng stem mo, na box mo for your keyword, okay lang yon. Basta siguraduhin mo lang dun sa binabox mo nandun ang totoong keyword. Baka box ka lang ng box. For example, ang binax mo dito, which receives. Okay? Hindi ganun yun, Kailangan ang binabox mo yung actual keywords. Now, kapag ganyan ang mga keywords mo, anong sinasabi nila? Okay? Sabi nila, mag-prioritize ka daw. Okay? And then, pag magpa-prioritize ka, magkakaroon tayo ng changes sa hand. Okay. Sabi ng keyword, mag-prioritize ka daw. Kapag hiningi ng keyword na mag-prioritize ka, baba mo, hand mo, like this. And then, you will have the 3 basic guidelines of prioritization. Okay? Pag nakataas, issue, client, keyword. Pag nakababa, the 3 basic guidelines of prioritization. And when we prioritize, we have three basic guidelines. And what is the first guideline? The first guideline is none other than, okay, most of you will answer ABC. Actually, no. Hindi unang guideline ang ABC. Why? Kasi tatandaan nyo, ang ABC, useful lang siya kapag ang choices mo are all physiologic. Pero always remember, hindi siya useful kapag may choices kang psychologic. So, the thing about it is the first guideline is not ABC. And what is the first guideline? It's none other than Abraham Maslow's hierarchy of needs. Okay? Now, follow my fingers, ha? Ano ibig sabihin? Ano ibig sabihin nun? Keyword is asking me to prioritize. My first guideline is Maslow's hierarchy of needs. So, anong una sa Maslow's? Physiologic, bago ang safety and security, bago ang love and belongingness, bago ang self-esteem, bago ang self-actualization. Okay? So, ano ang sinasabi ng first guideline? Okay, it's none other than Abraham Maslow's hierarchy of needs or Maslow's hierarchy of needs. Okay, next guideline. Keyword, asking you to prioritize, and then second guideline. And what's the second guideline? Sabihin mo na yung sinabi mo kanina. And what is that? It's none other than ABC. Very good. So, prerequisite ng ABC si Maslow. Okay? So, Abraham Maslow's hierarchy of needs and then ABC. Ano ibig sabihin ng ABC? Airway, breathing, circulation. May pumasok sa emergency room, okay, na client, merong dumudugo sa kanya, may masakit sa kanya. Anong ipaprioritize mo? Dumudugo o masakit? Very good. Okay? Walang pain sa ABC, pero nandun si circulation. May pumasok na client sa emergency room, okay? May dumudugo sa kanya, hindi siya makahinga. Ano ipaprioritize mo? Kung paano isinulat ang ABC, ganun ang kanilang pagkakasunod-sunod. Therefore, una ang hindi makahinga bago ang may dumudugo. Kasi airway before breathing, before circulation. Okay, again, ha? Keyword, prioritize. Okay, ano to? Maslow's hierarchy. Ano to? Okay, yes. ABC. And then, keyword, prioritize, our third guideline. And what is our third guideline? It's none other than the steps of the nursing process. Okay, steps of the nursing process, add pay lang yan. Ano ibig sabihin? You assess before you diagnose before you plan before you implement before you evaluate. So those are the three guidelines whenever you are prioritizing for your client. Okay, so again, what is this? It's not issue, it's Maslow's hierarchy, ABC, nursing process. So those are your guidelines in priority setting. Maslow's hierarchy, ABC, nursing process. Okay, let's have a recap. Issue. What's the rule of the issue? Whatever is the issue, that is the only possible answer. Ano daw to? Client. All possible answers are client-centered. Ano daw to? Keyword. Keyword ang magsasabi kung time na para prioritize. Okay? 3 guidelines in prioritization. Maslow's hierarchy, ABC, nursing process. And then of course, keyword din ang magsasabi kung time na para Look at my motion. Ano yan? Good or bad? Up, down? Gawin mo nursing. Like, dislike, hindi yun nursing. Facebook yun. Ano? Okay. Keyword ang magsasabi kung time na ako para mag positive or negative. Okay. So, positive or negative response. A positive statement is saying a positive thing or a basic nothing wrong sentence. For example, sabi ng Stordalahan, ikaw ay magiging nurse. Okay, tell me, is that positive or is that negative? Most definitely, that is positive. Okay. Negative is the exact opposite of a positive response. For example, it is biased, it is judgmental, it is offensive. For example, may batang lumapit sa'yo, ate, kuya, di ka magtatap. Okay. So, that is negative. Tama? Okay, so that's negative. That's what we call positive or negative response. Now, dito papasok ang tinatawag kong brandings. Ano yung brandings? Brandings is literally, naglalagay ako ng positive or negative dun sa gilid ng stem at sa gilid ng choices. Okay? So, literally, naglalagay ako ng positive or negative sa gilid ng stem at saka sa gilid ng choices. Now, paano ko malalaman kung ang stem ko is positive? Well, ang magsasabi sa akin kung positive or negative ang stem ko is none other than if you guess the keyword, it's none other than the keyword. Okay? So, kapag ganito ang mga keywords ko, ibig sabihin, my stem is positive. So, maglalagay ako ng positive dun sa stem. And then, walang keywords ang choices. So, I will use my judgment. And one by one, maglalagay ako ng positive or negative dun sa gilid ng choices. Okay? Paano naman kung ang mga keywords ko ganito? Ibig sabihin, my stem is negative. So, maglalagay ako ng negative sa gilid ng stem. And then, one by one, maglalagay ako ng positive or negative sa gilid ng choices. So, that's how you do the positive, negative. And then, once na-brand mo na si stem, ang ine-next mong iba-brand are the choices. Now, walang keywords ang choices. So, you will use your judgment. Later, I'll teach you how to use your judgment properly. Okay? Now, once na-brand mo na ang stem, you brand your choices. And then, you apply the rule of thumb. And what is the rule of thumb? Okay? So, the basic rule of thumb is a positive stem is always looking for a positive answer. And a negative stem is always looking for a negative answer. For example, your stem is positive. You have 2 positives and then 2 negatives. What could you do? Since the rule of thumb, a positive stem is always looking for a positive answer, you could already now eliminate or burn your negatives. Okay? Now, for example, your stem is negative. Okay? Now, what could you do? You have 2 positives and then 2 negatives. Okay? So, you can now, sabi niya, a negative stem is always looking for a negative answer. You can now eliminate your positives. And that is the 5-finger modification. Okay? Let's have a recap and then we'll go to how to use this in different types of questions. Okay, let's have a recap. Issue. What's the rule of the issue? Whatever is the issue, that is the only possible answer. Ano daw to? Client. What's the rule of the client? The only possible answer is a client-centered answer. Ano daw to? Keyword. What is the rule of the keyword? Okay, keyword ang magsasabi kung time na para prioritize. Okay, 3 guidelines of prioritization. Maslow's hierarchy. ABC. Nursing process. Keyword din ang magsasabi kung time na para positive, negative. What's the rule of thumb? A positive stem is always looking for a what? Positive answer. A negative stem is always looking for a what? Negative answer. Okay? So, let's go with the proper sequence before we go to a different let's go with the proper sequence before we show you examples, before I show you examples. Okay, so let's go with the proper sequence on how to answer the question.